Ke aku nui, ke aku rātou. Ke aku nui, ke aku rahi, tēnā koutou katoa, nau mai haere mai ki tēnei webinar. I tēnei wā, me inoi tātou. Whakatakata hau ki te uru, whakatakata hau ki te tonga. Kia mā kina kina ki uta, kia mā taratara ki tai. E hi aki ana te atakura, he tio, he huka, he hauhu. Ti hei, mauri ora. Nā mihi nui ki a koutou, kua hui hui mai nei, ko waio. I te taha a tōku mama, he uri ahau no Kaitahu, ko te aroha me murihiku ngā marae, ko Karen Wright tōku ingoa. My name is Karen Wright, and I am co-chair of Te Rōpū Āparangi Waipiro, the Alcohol Expert Panel for Health Coalition Aotearoa. It's my absolute privilege to be able to briefly welcome you into this space and to introduce our wonderful MC for the remainder of the hour. Councillor Josephine Bartley is an Auckland councillor for the Maungakiekie Tāmaki ward who's been a vocal supporter of reducing alcohol harm, especially in her local community. She's spoken out publicly and pushed for stronger local alcohol policies. So I will hand over to Josephine now. Kia ora, Josephine.
Kia ora, thank you, Dr. Karen. Tēnā koutou katoa, o te whatalofa atu I le paria, ma le mamalu o le awhia nei, ma lolo suifu moa, ma le langi mama. Thank you very much for the opportunity to be part of this webinar, Health Coalition Aotearoa. As with everybody else that is on this webinar, we all have concerns about alcohol harm in our communities. For me personally, it was one of the motivators to stand for local government, because in my area, a lot of what came from the schools, from our community providers, was that we had too many liquor stores. So it works in perfectly with the theme easy to buy, because it is easy to buy alcohol in Tamaki Makaurau. But I chair the Regulatory and Safety Committee here at Council, and very glad that we finally got the local alcohol policy over the line after 10 years in court action. So that provides some more protection for our communities regarding access to off licenses and alcohol. Our first speaker is Professor Antonia Lyons, who is the Director of the Centre for Addiction Research at Waipapa Taumata Rau, University of Auckland. She brings a critical health psychology perspective to her work in multidisciplinary teams, seeking to identify the broader drivers of harmful behaviours to improve wellbeing outcomes. Her research has explored drinking practices and cultures, alcohol consumption at different life stages, and the digital marketing of alcohol products, which is what she will be focusing on today. Over to you, Professor Lyons.
Kia ora, Josephine. Thank you very much for that lovely introduction. Can everyone hear me okay? Yep, great. I'm just going to share my screen. Okay, hopefully you can see that now. Is that coming up okay? Yep, great. Okay. So tēnā koutou katoa, thank you very much for the opportunity to talk to everybody today. I'm going to focus on alcohol marketing, particularly in digital spaces, but I wanted to just begin by outlining the context in which this work is being done. So experts in Aotearoa agree that alcohol is the most harmful drug. It is associated with a whole range of short-term harms, both to the self and to other people. And it's also associated with long-term harms, including heart disease and cancer. In 2023, it was estimated that the total societal cost of alcohol harms in Aotearoa was over $9 billion. So alcohol marketing is one of those very effective ways of alcohol industry promoting its products to people and it has been shown to increase the amount people drink, how often they drink, and the age at which they start drinking. And a recent review in 2020 concluded that based on the evidence over the last 50 to 60 years, we can claim now that there's a causal relationship between being exposed to alcohol marketing and youth drinking. So that's traditional forms of marketing, but we now have, in the previous couple of decades, digital alcohol marketing. So that's marketing in the digital space. And what the research shows about digital marketing is that being exposed to marketing on digital devices has been linked to increased consumption of alcohol in young people and the age at which they start drinking. And actually actively being engaged with alcohol marketing is also associated with the amount that young people consume. One of the things I want to just outline briefly in these few minutes is to explain how digital alcohol marketing is actually fundamentally different to more traditional forms of alcohol marketing because of the systems and the technologies that it's hosted on. And I'm going to talk about limbic media, the business model of social media platforms and personalization. And because of these systems, it's likely to be even more influential on people's consumption. Limbic media is this notion that, well, we know that platforms, social media platforms, and the smartphones that they're hosted on have been designed using insights from addiction research. And it's the addiction researchers and the design is to engage people and get them using these platforms to engage the limbic system. So that's the pleasure and reward center of the brain, to ensure that they keep using them to maximize profit for the tech companies, the social media companies. The underlying business model of social media platforms is to create a sense of indispensability, for these platforms to be indispensable for people in their everyday lives. And in this way, the platforms can capture even more amounts of people's data, their time, their behavior, their attention, their affect, and use that data to be able to market to them and ultimately to maximize their profit. The other key concept here is personalization. So the advertising on social media platforms is automated. It's done by machine learning, and it's this massively big experiment. So they're experimenting all the time, these algorithmic machines with data, so that they can get the content into people's feeds at the right time, nudging them towards alcohol consumption, purchase and consumption. So getting the content, changing it in real time to ensure that that content arrives at a time that's more likely for them to purchase the product and consume it. And again, that's to maximize profit for the alcohol companies, but also for the social media companies. So everybody sees different things in their social media feeds, and we don't know what other people see on their feeds. And we don't know what other people see on their devices. It's all very much individuated. Personalization on social media platforms means that it's possible to identify within the system when users are most likely to be susceptible to alcohol products and get that marketing in their feeds. And that's quite an important point that we'll come back to. So I've been working with this amazing team, a group of researchers from Whāriki, Victoria University and Auckland University, to look at social media and digital marketing of unhealthy commodities, and particularly alcohol. And what we've done, it's a bicultural project, and we have undertaken a survey with almost 3,700 young people. We have undertaken 10 friendship group discussions with young people talking about their social media use and the ads that they see. And we're in the process of doing a digital ethnography where young people screenshot any ads that they see and also record their phone and talk about the ads that they see in their social media feeds. In terms of alcohol marketing, what we've found is that in the survey, 71% of the young people said they'd seen ads about alcohol and this is within the social media platforms that they use regularly, at least once a week. And you can see the platforms that they're reporting seeing the ads on. Of those who are only aged 14 to 17 years, 43% of them said they saw alcohol marketing. So the ads are reaching underage people. We also found that Pākehā and Māori participants reported seeing about the same amount of ads, and this was significantly higher than Pacifica or participants of other ethnicities. Of the people who had seen alcohol marketing across the entire sample, 41% of them engaged with the alcohol ad. So that means they clicked on it, they liked it, they shared it, they entered a competition. So that active engagement is quite important as well, because what we found in the survey was that engaging with an alcohol ad was positively related to hazardous consumption as well as purchasing alcohol online. Our digital ethnography is showing that young people, and all of the people who have done the study so far, have said they're absolutely shocked at the number of ads they see now that they've been trying to screenshot them. But what we found was that there were alcohol ads in amongst all kinds of other ads, particularly online gambling, and this is throughout the day, and junk food marketing. Our digital ethnography participants talked about the ads they saw with us in an interview. And so this is Alexis, and Alexis was 23, and she said, this is her, she screenshotted this TUI ad, and she said, what I found quite interesting about this ad is if it didn't have the TUI brand, which is quite recognizable, I don't think I would have known it was an alcohol ad. A few of them were like that. They didn't actually advertise the beverage at all. They were advertising an idea. It's like selling you an experience rather than a product. Alexis also said, this one again, I didn't realize it was an ad. I actually had to scroll back up to it because I went, oh, it just looked like any other video, any other content. The very interesting thing with this is that the way they were selling it in like a sophisticated way. So the ads are designed to look like not being specific ads, just to be the same as the other content that you get in your social media feeds. Andrea, a young Māori participant, said, I didn't really get any vaping or drug content, but it was very much alcohol that was pushed at me, a lot of it. So quite often, subconsciously, through different reels, people trying to push a concept or an idea regarding something and use alcohol to get the point across. So then the slushy maker, so this was an ad for a slushy maker, but they're using rosé. And Andrea also went on to say, my best friend's a recovering alcoholic. So it just makes me more conscious of like what some people are going through. It doesn't really faze me, but some people are going through a really hard time. And then this kind of these continual alcohol ads being thrown at them. So we have written about how the digital marketing of alcohol products does threaten those who are most vulnerable to them because of the digital marketing systems. And it's not just social media. This is happening in other digital environments. So a project that's currently being led by Tasia Huckle at Shaw Research Centre is focused on metaverses. And this is Decentraland. This is a metaverse that you can go into. And young people are, there are multiple metaverses, and you can go into this metaverse. You can go to a bar if you like. You can go and ask for a drink at the bar. You can go into different spaces in the metaverse. This one's sponsored by Wisha Vodka, and there are things you can do in there. You can play games. As soon as you go in there, you can be taken to the Wisha Vodka site. You can say that you're over 21, and you can buy vodka immediately. So this is an American vodka. And it's not just big alcohol who are doing this kind of marketing. There are other actors involved. So a project that's been led by Ian Goodwin at the University of Auckland has looked at Instagram influencers and found that there was a survey of almost 900 young people, and they rated their favorite 3 influencers or people they follow on Instagram. And of the 45 top influencers, 9 had their alcohol brand. And they posted regularly about their alcohol brand. Kendall Jenner, Dwayne The Rock Johnson, Tana Mojo. Last year in September, Beyonce launched her new whiskey brand to over 300 million followers. So just to wrap up, alcohol products are in this space being continually marketed, embedded within everyday social media feeds on devices that are designed to be hard to stop using, and in ways that don't actually appear as marketing. The marketing's reaching underage users. It reaches users when they're most susceptible, which I think is an important point, and it influences purchase of consumption. So that these marketing forms are novel, they're powerful, they're pervasive, they're harmful, and there's a serious lack of transparency about them. We don't know who's seeing what and when. but it's really profitable for digital tech companies and alcohol companies. The whole system functions to maximize profits without any regard for public health. And we really just have very little oversight about what's going on in this space. So we need to change it. We need to look at our alcohol legislation and think about it in terms of our digital world. And we would call for a complete ban on digital marketing. And that's me. Thank you.
Thank you. Thank you, Professor Lyons. That was very worrying and very interesting, because a lot of the focus has been on the shops and what you see in the shop front in our communities. And yet there's a whole different world out there with the digital online presence and what our young people see, because everybody's on their phones. There are some questions there, and I'll leave it to one of the administrators to respond to those questions in the chat. But for now, we'll move on to our next speaker. Sarah Sneyd works at Alcohol Healthwatch, addressing alcohol-related harms through policy and health promotion. She has vast experience working in alcohol harm, including in South Auckland and primary care and maternity spaces. Sarah's presentation will focus on the growing trend of online alcohol delivery in New Zealand, particularly rapid delivery within 2 hours. She will discuss findings from an Alcohol Healthwatch study showing that many alcohol deliveries in Auckland are made without checking age identification or are left unattended. The presentation will explore the implications of these practices for alcohol harm and propose next steps to address the issue. Over to you, please, Sarah.
Jordan, thank you so much for that warm introduction. All right, give me just 2 seconds to share my screen. All right, let me know if that hasn't popped through. Kia ora. So my name's Sarah Sneyd, Health Promotion Advisor at Alcohol Healthwatch, and I'm really excited to be talking to you guys today about what our findings around age verification processes of alcohol delivery companies in Auckland. And this piece of work, we focused on rapid delivery companies. So that is companies that are delivering alcohol in 2 hours or under. Now, Antonia covered off the alcohol harms in general, so thank you so much for that. I'm going to dive right into the background for online sales and delivery specifically. So like so many places around the world, when COVID hit, the online sales space just boomed. So that was with alcohol, but also across food and another number of other sectors. So in New Zealand, 18% of people ordered alcohol online for the very first time during those COVID-19 lockdowns. Now, if for off licenses, so that is bottle shops or supermarkets that sell alcohol, they automatically have a remote license attached to their normal license. Now, up to that point, many had never used it before, but finding themselves in this new environment, many actually thought, okay, yeah, let's expand and start doing remote sales. So it took off, and it's never really slowed down since. Now, I guess 2 things we need to know about the laws around this online space. First of all, there's not too much in our laws at the moment. Basically, when our laws were created in 2012, the online delivery space was predominantly relegated to, it was sort of your niche boutique wine cellars. You might order online and would take like a week to deliver. And so the only things that's required, if I'm selling alcohol to someone, I have to take reasonable measures to ensure they're over the purchase age. Now, reasonable measures is defined in the law as 2 tick boxes on the website. You may have seen in Antonia's presentation, we saw an example of one of those tick boxes on that Wisher vodka site. It said, oh, yes, I'm over, I think it was 21 maybe, but, it would be 18 here. So that's one tick box, cool. And then the other tick box right before you order it, and that's your job done if you're selling alcohol, cool. You've taken reasonable measures. So it's just those 2 tick boxes. And I will state as well, it's just a tick box. There's no kind of back-end checking of an ID or anything like that in that online space. Very, very simply 2 tick boxes. So, and if you're delivering the alcohol, there's no requirement to check ID. There's no requirement that you even have to see someone when you hand it over. The only thing you'd be captured under is the very general that we can't supply to someone, and that's sort of someone under the purchase age. So that's including delivery drivers as part of that. And to date, before this research, there was no research around what's actually going on in this space. Are people checking ID? What on earth's happening? It's all happened so very quickly. And we are one of the only countries in the OECD that actually allow alcohol delivery outside of the national trading hours. So that means that even when you can't be going into a shop to buy alcohol, you can be having it delivered online. So we are very much behind where the rest of the world is with the laws around online sales and delivery. It's taken off. Our laws are not up to date and we've sort of been left floundering. So what did our study look to do? We aimed to document the age verification processes for online alcohol delivery companies in Auckland, focusing on rapid delivery. So in short, we ordered a bunch of alcohol and we checked how fast it was delivered and if they checked ID on the other end. Simple as that. We had a young researcher who worked with us, and now she was 21 at the time, and I tell you that so you can picture she really did look 21, so definitely a young looking person who was ordering and accepting these online orders. And we had them delivered from 16 companies, 3 orders each. So we gave them, extra chances to see what they were going to do. So 3 orders each from these 16 companies. Where we could indicate that we wanted it contactless, we did so. And basically, our student had them ordered to a home address, waited to see first if they'd leave it. If it didn't look like they were going to leave the alcohol, come down, accept the order, and we'd only offer our ID when prompted. And then we just noted how fast it came and who was actually asking for ID. Now, what did we find? So almost 3/4 of the orders did not have any ID checks at all, 73%. And indeed, actually, just under half, so 49% of those orders were just left contactless at the door. In terms of speed of delivery, now for those rapid delivery companies I mentioned, so under 2 hours is what they advertise, they can get that liquor out to you. It's actually been delivered much, much faster than that, under 30 minutes. So 29.5 minutes was that average time that those alcohol deliveries were being delivered, and the quickest time was 17 minutes. So really, really fast actually. In Auckland, it appears you can be ordering alcohol and having it delivered. And almost 90% of the delivery companies broke their own restricted items policy. Now, what I mean by that, so I've explained sort of what they're legally required to do, which is not a huge amount, but in fact, all of those companies that we delivered from had an internal policy, and it was online, and it would say things like, oh, we always require ID on delivery, and they would all sort of say all these really good things. And so we sort of just noted, okay, you've obviously got some sort of policy here, what's going on? But no one's, in our study anyway, appeared to be following the policy. In fact, only 2 of those companies followed the policy and checked ID for every single one of those orders. Now, why is this important? So I think, obviously the main issue is that if alcohol's been delivered without an ID check, it makes it really easy for people under the purchase age, children and young people, to be getting a hold of alcohol. If all that's required is 2 tick boxes on a website, well, how easy is that to circumnavigate? In which case, what we've proven is that alcohol is likely to be delivered to that child, potentially, without an ID check. And in fact, chances are it's just been left at the door. So definitely some issues here, and it's not aligning with what people expect if you go into a shop to buy alcohol. Very much a different landscape. But also a number of harms around that home delivery aspect, and particularly that really quick delivery. It makes it so much easier and faster to get a hold of alcohol. And we know from research that means you drink more. And if you're having a binge drinking session, if you're having a big party, as research again shows, that is likely to extend that binge drinking session long after it would have otherwise naturally wound up by itself. So I mentioned that 2 companies checked ID for every single one of the orders. And those were Uber Eats and DoorDash. Now, we were surprised, to be honest, at this. I kind of thought some of those third-party delivery companies, like the Uber Eats and so on, might not be quite as good, I want to say, as some of the others. But actually what we found is they were much more likely to be checking ID at the door, even if they're getting it out very, very quickly. We've since sort of got more information from places like Uber Eats and DoorDash, and many of them have systems in place already where to complete that order, they actually have to scan an ID, and it checks it at the back end before that order is allowed to be completed. If the driver can't complete the order, they can return it to the shop and not be financially penalised. So definitely ahead of where many other delivery companies are at. Some of the ones that we thought might be doing a better job of adhering to their own policies, such as some of the supermarkets, didn't check ID for any of them. And a number of these companies outsource it to courier companies like New Zealand Post. Now, nothing wrong with that, but of course there's big question marks there, like, oh, are these posties being trained actually because they're delivering alcohol? This is not an ordinary commodity. This is an addictive substance. So are they being trained in what they legally have to do? Which is, as a reminder, just to not be handing it over to someone under the purchase age or someone intoxicated. Are they being told about the company's internal policy about checking ID? There's just big question marks there, and we're not sure. But seeing as we noticed a lack of ID checks across the board, that says to me that there's no training, there's no socialization of those policies and requirements for courier companies, as well as all the other drivers. And of course, we, almost half of the orders were left unattended. Big worries there. Anyone can be walking past and grabbing it. It's not hidden. If it was delivered in a box, often it says it nice and clearly it's alcohol right on the front. So there's, you're left with no doubt. Sometimes it was even just in an open bag, because we'd order, say, just one bottle of wine. It was delivered in an open bag and left right there at the door. So huge issues with that. Now, the laws only state, of course, for a delivery driver that you can't hand it to a minor or an intoxicated person, as I mentioned. Well, that leaves a really big loophole, because if you just leave it at the door unattended, well, you've not done either of those things. You're completely off the hook there. So definitely an area that needs to be considered and addressed in our legislation. Okay, but what are our recommendations? What now? So obviously, we don't think there should be allowed contactless delivery. You should have to hand that alcohol to someone. You can't be leaving it at the door. That's what we would recommend first and foremost. But of course, as well as that, there needs to be mandatory ID checks, both at the point of delivery, but also at the point of sale. So once, on that online space where someone's actually doing the ordering, there needs to be an ID check at that point. And they're already doing that in many states in Australia at the moment. So some of those bigger companies that operate across both countries are already implementing that technology. It's not such a stretch to bring it into New Zealand. And it just makes sure that the alcohol's only being sold to someone over the purchase age. There also needs to be mandatory training of staff, and that includes delivery drivers, for their own safety as well as the safety of others. They need to sort of know what they are liable for, what they maybe aren't liable for, but also how to protect their safety, that they don't have to deliver that alcohol if they feel it's unsafe to, or if someone's intoxicated. All these things are important. We think there needs to be sort of like a safety pause or a circuit breaker, so that it really cuts down on those very, very quick deliveries. We say next day, still really quick. It's about a balance between that convenience, but also not extending those binge drinking sessions. The delivery hours do need to be reduced, at least in line with the national trading hours, like many other countries overseas. It'd be great to have enforcement of this. There should be really a separate remote sales license, rather than just sort of getting it automatically as part of your normal shop liquor license. And of course, it'd be really great and useful to have regular reporting from the industry. We've seen in the past few years, the space has changed so fast. As I say, we've been left floundering. If we have regular reporting, we can try and keep on top of some of these trends. Overseas they're doing drone deliveries. There's all sorts of things that we don't want to be left in the lurch again with. Now, of course, our study did have a number of limitations. I think it was a small study. We're a small team, but it would be really great to replicate this using a number of research assistants over multiple sites. You could look at kind of different sorts of companies, whether they're long-standing ones or whether they're sort of new ones doing something slightly different. Are there differences between regions, say Dunedin, where there's a high student population, and looking at whether you can have a minor accepted delivery, just to sort of strengthen the argument actually that it could be a way that young people and children can access alcohol. Now, in terms of ongoing actions, part of our job at Alcohol Healthwatch, we fill in gaps in the research, but then we also have a job to be sharing it with both the community and decision makers. Now, there was a there's actually been a lot of interest in this piece of work. At the time it was released, so that was November last year, the publication came out. We did a number of radio interviews. There were a number of media articles. We did a bunch of stuff on social media, but also with the decision makers. The Minister of Mental Health was asked about the research the day it was released. We've shared it with the Minister who looks after the alcohol laws, and her policy team. We've shared it locally as well, so with the local councils and the district licensing committees who are in charge of giving out licenses, as well as with our sector, both overseas and locally. And the overseas folk were particularly interested because honestly these stats were so bad compared to similar studies where we've done it overseas. So almost been an object of curiosity there. All right, so I'll leave it there. Thank you so very much. My details are there, but I'll be happy to take any questions at the end as well. Thank you so much.
Thank you, Sarah. Some good recommendations there of how to address the issue. We all know that there was a boom in alcohol sales during COVID, and it seems to just be continuing. So thank you for that. Our next speaker is Tania Henderson, a fetal alcohol spectrum disorder expert, advocate, and whānau order navigator with over 20 years of experience supporting at-risk whānau. For the past 13 years, she has focused on raising awareness of FASD through a holistic to Ao Māori approach, helping whānau understand the impacts of alcohol on their health and whakapapa. Tania was also a key member of the NZ FASD Diagnostic Guidelines Project team, which developed the first Te Tiriti or Waitangi-centric guidelines for FASD diagnosis. Over to you, please, Tania.
Kia ora koutou, ngā menui kia koutou. Absolute pleasure to be here today to have a bit of a kōrero about FASD. Now, there you go. Oh, on my phone, that's it. And we're going to start from the beginning. So today I'm going to kōrero about looking at alcohol harm through FASD lens. So I'm going to start with a communication that happened in 1840, and thank you, Antonio and Sarah, for the background around about alcohol in this space. I appreciate your kōrero. So in 1840, a communication with all lieutenant governors in Australasia, Lord Russell, Secretary of State of War and Colonies, wrote that between the native who is weakened by intoxicating liquors and the European who has all the strength of superior civilization and free from its restraints, the unequal contest is generally of no long duration. The natives decline, diminish, and finally disappear. So for me, from a Māori perspective, that sort of hit hard with me and gave me a bit of understanding. So looking back and laying the foundations for FASD in New Zealand, now I often refer to FASD as an inherited disability, and this timeline will show why. Now we're going to step back a little bit further, whānau, than what we know now. So, behold, thou shalt conceive and bear a son, and now drink no wine or strong drink. So this was, the impact of alcohol was identified in the 1000 BC in the coming of Samson, Judges 13:7. Aristotle, 384 BC, foolish, drunken, and harebrained women most often bring forth children like unto themselves, morose and languid. The great British gin epidemic of 1720 to 1750. The College of Physicians in London warned the British House of Commons that alcohol is often the cause of weak and feeble distempered children. Now, the reason why I included this, because it's a timeline. So if we think about what was happening at that time in the world, that's when we start first seeing ships coming over. James Cook come over in the 1700s. So that's why I look at it as inherited disability. The impact on our communities. tupuna observed alcohol harm. In the 1850s, several petitions to Parliament highlighted the impact of alcohol on Māori. 1856, Waikato and Waipa Chief's letter, do not let any intoxicating drinks come to this land to Waipa, but let it be kept in Auckland at the inns. Let the Māori law, which has asserted to be by all the chiefs in this place, Waipa and Waikato, be sacred, namely that the natives not be allowed to drink spirits, is the worst thing hereunto brought into New Zealand. The mid-1800s, central body of chiefs in Poverty Bay forbade the consumption of alcohol and fined offenders. In 1886, Te Arawa chiefs petitioned that no license be allowed on the land. King Tawhio did an abstinence pledge. In a document that we're all familiar with, is the 1874 Haimona Te Atarangi and 167 others petition to the House of Representatives. This is the first time, not really the first time, but our government was made aware of the actual impact. We know that there are tupuna before that were petitioning documents in regards to alcohol and the impact. Oh my gosh. So hide this whānau. And in 1879, all South Island tribes petitioned for a total alcohol ban. Now, to me, from the 1800s, our government has known about the impacts of alcohol, but still nothing was done. And here in front of you, I've put up the petition of Haimona Te Atarangi and 167 others. And the caption on the side there that's brought out is, our children are not born healthy because the parents drink to excess and the child suffers. If you have regard for us, the Māori people, send away this evil which brought to this island to destroy us, our lands and our children. And that's quite a powerful petition that went through in 1874. And it showed us tupuna trying to stop this harm that they were seeing, observing happening to a tamariki, to a whakapapa. And community. So this is Tai Rawhiti tupuna response to alcohol harm. 1901, Haurata banned bringing of alcohol onto the marae. Saparangata was chairman of this council. 1911, convinced the Haurata Māori Council to conduct a poll on the prohibitional sale of alcohol. Many wahine Māori favoured that, and by a narrow margin, very small margin, a 3-year dry period was agreed upon. 1914, the government refused to fund another poll. And in 1922, a special law was made so the second poll was possible. After that poll, hotel licenses were restored. 1929, Princess Te Puia forbade the consumption of alcohol on Tūranga Waiwai Marae when it was built. And in 1974, Te Poho Arawiri Marae and Tai Rawhiti banned alcohol. So all this journey along forward in the mahi that we're doing at the moment, our tūpuna have been fighting for change, fighting for us to make a stand and stop selling alcohol. Now, if we look at this, what does the research say? I won't go over that. I'm just having trouble on my phone. International research has found that people living with FASD face huge challenges and inequities, many due to the lack of support, including 90% have a diagnosed mental health problems, 80% of adults depend on others for their daily needs, 80% are not raised by their biological mothers, 80% have employment problems, 60% have expelled from or dropped out of school, 60% have been in trouble with the law, 50% have inappropriate behaviour, 50% have been confined for mental health reasons, alcohol and drug treatment, or as a consequence of a law violation. Now, you might be asking us, why am I showing international studies or research on the impact that alcohol has on FASD? And the reality is, whānau, is that at this point in time, we still haven't had a prevalence study done. Although there has been a commitment from the government that this will take place. Also within that research period of time, there's also pockets of research being done around our country, and it is my hope and the hope of many in working in this field that the researchers and projects that they're researching, we will come together, miri together, you know, and instead of doubling up, let's work together. Let's do a plan on how we can get the best value for the funding that we get to do these research projects. Yeah. Impact on our communities, today's reality. Our mokopuna are still being born with FASD. We're seeing an increase of our grandparents raising their mokopuna and sometimes their great moko with little or no resources to support them. Our mokopuna are under the care and protection of oranga tamariki. In this space here, in the field that I work in, quite often what I am seeing more and more of is tamariki that have been in care for life or care for a long time. When these children, or rangatahi, get to a certain age, they're being handed back into care of whānau who are not necessarily equipped or understand the complexity of FASD. So they are also under-resourced with their training. Our mokopuna, as we know, will be presenting high in the many stats across all the sectors, including health, education and justice. Yes. So there's an expectation out there that our whānau seek support out in the community, but if our systems are not trained or are unaware of what FASD is, they are unable to adapt their practice. Our system, like I said, is not equipped to deal with the complex needs of the mokopuna with FASD. What we do know is that it costs between $6,000 and $7,000 to have an assessment done. However, within the mahi that I do, I am seeing a lot of whānau who are not looking to have an assessment. They just want to know how they can mahi or tautoko their tamariki that they're raising. But we do encourage them to go for an assessment if it is possible. But unless you're funded through different streams or your children are being, or rangatahi for the courts where it can be ordered to have an assessment done, 9 times out of 10, it's very difficult to get the funding to pay for an assessment. Our mokopuna are living a reality that comes from decades of inaction, successive governments, ones who, even with international data, are still hesitant to recognise FASD as a disability, thereby denying our mokopuna the supports they're entitled to. I'm not sure of my time. I think I'm getting pretty close to my time. But I want to share with you, just to finish off on a story here with my niece, and it's how the supports that we can do, wraparound supports. 2012, my niece came to me. She was in a real bad state. She had her children removed from her. She was going through the court. She was alcohol, drug, her background, her life. She started learning about FASD through this process. But when you look at the true cost of what's happening to our whānau and our communities, when we put all these services around them, you can see the cost moving forward. But in 2018, she got a tamariki back to her, which is a huge accomplishment. 2023, excuse the picture. I did put some smiley faces. These are the kids today. But what I want to say, this is 2023. And what we've been able to do over this period of time, in the 5-year period, is remove these services. But with some of the FASD, they're going to need lifelong support and systems in place for them. But in 2023, she welcomed her 4th FASD mokopuna into this world. And I'm going to finish that. So I'm just going to wrap it up. How was this done? It's by getting connected, staying connected, and become stronger together. Kia ora whānau. Thanks for the opportunity for this kōrero. Thanks, me.
Kia ora, Tania. Thank you very much for that. Thank you for humanising this discussion today and seeing the pictures of whānau that have come through this. I'll open it up for questions now. We have 3 questions there. Okay, here we go. Our first question is to Sarah. I don't know, Sarah, if you can see the questions there.
I can indeed. Okay, so is this the question from Richard?
Claire's iPhone, do we know what proportion of alcohol is now purchased online?
Sorry, Claire, I totally missed your question there. We don't know, and I think that's an area where we're trying to look more into. I've just done like a lagoima, but like an official information request of all the councils to get a sense of how many remote sellers are out there as sort of the first part, I think, of getting a sense of how prevalent, alcohol delivery, alcohol online delivery is at the moment.
Okay. The next question is, given Uber and DoorDash were the only two companies to comply with ID checks, does this suggest that this requirement is too expensive a process for smaller local businesses to comply with? Yeah. If this is the case, would this not favour dominant sector brands and delivery companies?
No, awesome question, Richard. I think no. So when we spoke to Uber and DoorDash about their high compliance rate with their internal policies, they basically said they kind of, because they work in Australia as well, there's stronger regulations there. And when they are sort of made to do something in Australia, rather than just do it for that region, they just replicate it across the whole Trans-Tasman outfit. So that explains kind of why they do that. But in terms of just sort of thinking of our study, so 16 companies, we did a range of large ones and smaller ones too. And we saw this lack of ID checks really across the board. Some of those big ones, I'm thinking of the supermarkets, those are big outfits. They're not checking ID when they deliver alcohol. So I don't think it's a matter of price. And certainly, it's not expensive to check an ID if you're a driver and you're delivering it. Of course, the training and all these other bits and pieces, there'd be some costs, but certainly I don't think it would be, a huge burden there. I hope that answered your question. That's a really good one, but I don't think the price had much in this case to do with why Uber Eats and DoorDash are a bit more compliant. And I'll just sort of just add into that, with some of these, when I started looking into these third-party delivery companies, that is the Uber Eats, the DoorDashes, they're overseas subjected to a lot more regulation. In some countries, they won't even allow them to deliver alcohol. So, we have a hypothesis that because they're sort of so much stricter overseas, it kind of just sort of trickles down to them being a little bit more robust in their processes here in New Zealand as a result. So, yeah, that's our sense.
Okay, thank you. Just a comment here. Amazing, Tania, Kaitaia Health Promotion here. Love your presentation and would love to make the info available in some of the Hapaitia Ngā Mokopuna events. So this is recorded. I'm guessing they'll be able to get a hold of your information, Tania?
Yeah, absolutely. Kia ora. Thank you for your Natasha. Absolutely. This has been recorded, and I did try to leave my presentation up on screen a little bit longer so you could get my contact details. I'd love to come home and tautoko your kaupapa as well. So a lot of my mahi was done in the far north from 2012 to 2019. Now I'm back in Ōtautahi, Te Waipounamu. So absolutely.
Awesome. Kia ora. Sarah, were the supermarkets included?
Hi, Kate. How are you doing? No, great question. Yes, they were. So we included both the foodstuffs and the Woolworths. So we didn't actually include Farrows Fresh. So I was sort of kicking myself after. So it would have been great to know what Farrows are doing. But for the New World that we ordered from, they only checked IDs for one of those deliveries, and there were 3. Countdown didn't check ID for any of the deliveries.
Okay. Given that the hours have been reduced in terms of times to purchase alcohol, would this not increase the binge drinking and or purchasing and higher consumptions?
I think that one's for me. Research would suggest no. So I think it's comes down to availability theory. If it's more available, if it's easier to get, and that includes sort of temporal availability, the time that you can access it, the more you're likely to drink. It's sort of the same with me and chocolate cake. If I make one and it's there, I'm eating more of it. I'm eating it more frequently. So what we see when the hours are reduced, people don't necessarily stock up more and then sort of drink it all. They sort of continue their normal purchasing patterns, but it just means that those people who predominantly buy alcohol between sort of 9 p.m. or 11 p.m. or later on, it's those people who have more of a problem, people who are really young. It's these sort of more vulnerable communities. The consumption in those communities does reduce.
Okay. Is the volume of alcohol sold online included in total volumes for New Zealand, or is that an estimate? I think that's for you, Sarah.
Oh, yeah. No, that's a really good question. I believe it is. So stats come out with the total volume available for consumption. I'm not actually 100% sure, but my understanding is that it is. So sorry, that's not a particularly robust question. I don't know if any of the other panelists know, but my sense is yes, it does.
Okay, and then we have a request here for Tania, your contact details again, please.
Shall I just put it in the chat and then
Yes.
they can just click? Yeah, bye.
Thank you. Okay, there does not seem to be any. Oh, there's one more question there. Okay. Who's this question? Does an FASD assessment enable whānau to receive funding and assistance?
Okay, so at the moment, because the government, as it's not a recognised disability, there is no funding per se attached to FASD. However, what the assessment does is this: it gives understanding of the behaviour of that child or that adult, and then the matauranga that comes from that and how to tautoko with them through their journey. 9 times out of 10 assessment for FASD, you'll probably have other disorders as well that will show, like ADHD, autism, all that as well. So at the moment, the government is not recognising, so there's no funding per se attached to it. However, in place, there has been a commitment that a prevalence study will be done. And then we are also at the moment reviewing the FASD strategic plan, which then will give guidance on that moving forward. So yes, it's a bit an area that's a lot of us are pushing for to be funded because it needs to be, because of the complexity of the disorder.
Ka pai. Cool. I just see in the chat someone's asking if Tash would like to ask a question. Do you have a question, Tash? I can't see who put their hand up. Oh, here we go. Tash. Over to you, please. No, nothing from Tash. Okay. No, nothing. That's okay. All right. Just to summarise, there is one more question there. So I think you'll all agree that it's been, again, very fascinating, very concerning. You think that we've come a long way in terms of trying to regulate the market, regulate the environment, and now we're dealing with this almost explosion online. Thank you, Dr. Lyons, for taking us through the digital marketing and exposure. Thank you, Sarah, for the status quo, showing us the current situation on the ground, and for Tania for taking us back to see the historic context and bringing that through to a human face. Thank you to the organisers for today. Today's webinar, Health Coalition Aotearoa, and I will now pass to Dr. Karen to close us with a karakia, and hopefully we look at next steps to address these issues from our different positions that we all hold in this regard. Thank you.
Tēnā koe, Josephine. Tēnā koutou I tō koutou kōrero rawe. Haven't we just had a feast of information and knowledge? So thank you all for this koha of expertise, but also fabulous facilitation. I think we've got much to consider, and I really look forward to thinking and seeing how we can apply this in our work and advocacy. Engari, me inoi tātou. Unuhia, unuhia, unuhia ki te uru tapunui. Kia wātea, kia māma. Te nākau, te tinana, te wairoa I te ara takatū. Koia rā e rongo, whakairea ake ki runga, kia tīna. Hui e, tai ki e.